Over 40 men are losing their mojo. Here's what you can do about it. I'm a urologist and pelvic surgeon, and today we're going to talk about what is causing erectile dysfunction in men over the age of 40. If you are new here, I am a board-certified urologist, and I make educational content every week on sexual health, bladder health, and much more. Make sure if you like this video, share it with your friends. So unfortunately, erectile dysfunction is extremely common. In fact, 30 million men suffer from erectile dysfunction in the United States alone. And when you break it down by age, about 40% of men between the ages of 40 and 49 have some degree of erectile dysfunction. That number rises up to 50% for men aged 50 to 59, 60% between 60 and 69, and 68% in men older than 70. So clearly this is something that becomes more and more prevalent as we age, but there's so many things that can cause it, and sometimes finding the cause can be difficult. In this video, I'm going to explain one of the most common causes for erectile dysfunction that is often overlooked in men over the age of 40. Now, before we get started, I want to let you know that we have an amazing free guide called Your Guide to Getting an Erection. And in this guide, we go over everything from lifestyle modifications, things you can do at home, to types of therapy, both physical therapy and mental health therapy, to help improve your erections, and even minimally invasive treatments that are available to you. If you're interested in learning more, make sure you click the link below. It's totally free. You just put your email address in and you can get this guide right away. Okay, so why exactly does this happen? Well, there's many things that can lead to rectal dysfunction. Most commonly, it's either vascular or psychogenic. So vascular meaning it has to do with blood flow or circulation, and psychogenic meaning it has to do with either your brain or your nerves connecting to your brain. And while most people will think, okay, well, I'm having rectal dysfunction, it must mean that there's something wrong with my nerves or my brain. Studies show that in patients who present to urologists like myself, most commonly it is due to vascular issues rather than neurologic issues. In addition, there can be other causes such as hormones, sleep disorders, medications, substance use, and more. However, we're talking specifically about men over the age of 40. And in that group, one of the most common causes that is often overlooked is actually hormonal changes. So what kind of hormonal changes? Well, as men age, they undergo what's known as andropause, or sometimes referred to as male menopause. Just like women go through menopause, which is a very well-known time of significant change in hormones, men also experience a gradual decline in their testosterone levels, usually starting around the age of 30, but more significantly after the age of 40. Now you might say, wait a second, doesn't testosterone decrease all throughout life? Yes, it does, but it decreases at a much more rapid pace after the age of 40. In fact, testosterone levels drop by 1% per year after the age of 40, whereas before that it drops about 0.5% per year. So this is a really significant decrease, and in addition, another hormone that declines in men as they age is the thyroid-stimulating hormone, which then leads to less thyroid hormone. Both of these combined lead to less production of other hormones, such as growth hormone insulin like growth factor, which is made by your liver after receiving signals from growth hormone, and dehydroepiandrosterone, or DHEA, which is made by the adrenal glands. All of these hormones play a role in maintaining healthy erections because they're necessary for libido, energy levels, muscle strength, fat distribution, etc. Low testosterone can also cause decreased desire, decreased energy, low mood or depression, which then can all contribute to erectile dysfunction. And while all of these hormonal changes are happening, oftentimes men are not really thinking about this as being related to their rectal dysfunction. They may be thinking, oh, it's probably because I'm not as young as I used to be. It's probably because I've gained a little bit of weight. It's probably because I have high blood pressure or diabetes. All of those things are true and can contribute to erectile dysfunction. But specifically, the hormonal changes are something that people don't often think about. The problem with not treating these hormonal changes is that it can have a cascade effect. So you can end up with increased visceral fat, you can end up with lower lean body mass, you can end up with decreased bone density, and all of these can really affect quality of life. It can also lead to increased risk of other medical problems such as heart disease, stroke, metabolic syndrome, type 2 diabetes. And you can see how these other conditions then can lead to further complications down the line, including erectile dysfunction. So if you're over the age of 40 and you're suffering from rectal dysfunction, you need to talk to your doctor about getting a full workup to assess your testosterone levels, your thyroid-stimulating hormone, your prolactin levels, and your DHEA levels. These are all important markers to see if you are suffering from some degree of hormonal abnormalities. And what can you do if you have these hormonal abnormalities? There's actually data to suggest that testosterone replacement in men who have low testosterone can help improve erectile function. And in some studies, they've shown anywhere from a 39% to 76% improvement in erectile dysfunction. That being said, it's not for everybody. And in men who have a very low testosterone, meaning less than 350, there's been shown to be a greater improvement in sexual function compared to those whose testosterone is slightly low. Also, you need to be careful with testosterone replacement therapy, because if you replace the testosterone too much, you can actually increase your risk of prostate cancer. Another thing that you can do is start on thyroid hormone replacement. This is usually in the form of levothyroxine, which is a synthetic version of the thyroid hormone. And if you're deficient in DHEA, there are ways to replace that as well. But in addition to addressing the hormonal abnormalities that can cause erectile dysfunction, there are also other things that you can do. Number one, you can try to make some lifestyle modifications. Things like stopping smoking, avoiding alcohol and illicit drugs, exercising regularly, eating a healthy diet, managing your stress levels, and getting enough sleep can all help with erectile dysfunction. If you're interested in learning more about these specific things and ways that you can incorporate them into your daily life, make sure you check out our free guide, Your Guide to Getting an Erection, where we go over all of these things in detail. Also, depending on what the cause of your erectile dysfunction is, you might benefit from either physical therapy or sometimes even seeing a sex therapist. For example, if you have rectal dysfunction due to nerve injury, whether that's from surgery or from radiation, then you might benefit from seeing a pelvic floor physical therapist who can help you with exercises to improve your nerve recovery and improve blood flow to the penis. These exercises are often easy to do at home and take only a few minutes a day. In addition, if you're suffering from erectile dysfunction due to psychological issues, such as anxiety or depression, seeing a sex therapist can be helpful. They can help you with certain techniques, such as cognitive behavioral therapy, to help reduce the psychological component of your erectile dysfunction. Lastly, if you have tried lifestyle modifications and you're still struggling, there are some medical options that are available to you. In my last video, I talked about the P-shot, which is a great option for many men suffering from erectile dysfunction. It's minimally invasive. It's an in-office procedure that takes only about 10 minutes and can have long-lasting results. I also mentioned another option called shockwave therapy, and this is another in-office procedure that has been gaining popularity and has very minimal side effects. Alright guys, I hope this video was helpful. As always, remember to take care of yourself because you're worth it.